It starts with numbness in your toes and ends with you losing your balance in the dark. It's the pattern of diabetic large fiber neuropathy. It's a slow creeping destruction of the longest, most vulnerable nerves in your body. So, let's talk about it, how this happens. Chronic diabetes causes link-dependent axonal degeneration and also large fiber sensory neurons leading to stocking gloves. So you see it on the hands and the feet. Stocking glove sensory loss starts in the feet, moves upward, proprioception, vibration, and reflexes. So we have a 62-year-old man, type 2 diabetes. He's like numb feet progressing over the last year. He's also got a decrease in vibration sense and a positive Romberg sign. So what is the diagnosis? Large myelinated peripheral nerve fibers. Why? The symptoms of decreased proprioception tell you that it's a large fiber neuropathy and sensory ataxia. So let's talk about just the ins and outs of this. So stocking glove syndrome, diabetic polyneuropathy, and you have microvascular complications, so retinopathy, nephropathy. And this whole idea of length-dependent axonopathy is important for diabetes because it occurs first in the longest nerves, the feet. And it varies depending on the type of injury involved. So small fibers are going to be your positive symptoms, like your pain, paresthesis, and allodynia. Large fiber is going to be your negative symptoms, numbness, loss of proprioception, etc. And so other answer choices you might see, like one could be axons of the C fibers. Those are going to be your pain and temperature ones. Distal axons of large ones, that's good. The large sensory fibers are what's affected first. Lumbosacral is going to be your dermatomal symptoms, not your stocking glove. Myelin is going to be Guillain-Barré, if they talk about myelin and peripherals. And posterior and lateral spinal tracts are going to be subacute. The posterior columns, it's like your B12 deficiencies. Small fibers, pain and temperatures, those would cause your pain and sensory ataxia. Small fibers also related to positive symptoms. DRG, that would affect the dermatomal distribution. Anterior, that's like ALS, anterior horn. And we talked about myelin is Guillain-Barré. Cortical spinal damage, upper motor neuron spasticity. Okay, that's all there is to it. So because in diabetes the nerves are the first to go, but the damage reveals itself in every unsteady step with ataxia at the end of it all. So stocking glove sensory loss, absent ankle jerk, positive Romberg sign, large myelinated peripheral nerve fibers are damaged first.